Hi, everyone. I'm so excited. Today we have a special guest. And again, welcome to a fantastic episode of Wellness Money Talk. I'm your host, Dr. Ndidi, and today we have Dr. Ezinne Ozurumba, aka Dr. Z. How are you today?
I'm great. And you?
I'm good. I'm good. I'm so excited. Thank you for joining us.
Oh,
Dr. Z is the owner and founder of Thrive with Dr. Z. And today she's going to be talking to us about functional medicine and thyroid. And she's been a practicing pharmacist for over 10 years. She's a certified functional medicine and nutrition practitioner, and she helps people with thyroid problems and low energy heal in a natural way. So thank you again. Welcome, Dr. Z. And we are so excited about this. There's so many people suffering from thyroid issues, and they're wondering, okay, are there natural solutions? Because I'm tired of taking medications and everything. So just tell us a little bit about what you do.
yes. Thank you so much. And thank you for this opportunity. It's such a great privilege. What I do, you pretty much said everything, but I help thyroid patients or people with thyroid issues and low energy heal in a natural way. And I don't utilize pharmaceuticals as the conventional doctors will, but we approach it in a more holistic way.
Awesome.
Yeah.
And so for people who are kind of like, okay, I've heard about thyroid. Where is the thyroid? Like, what does it do? What is thyroid disease?
Yeah. So the thyroid, before I talk about the disease, let me talk a little bit about the thyroid. The thyroid gland is a butterfly-shaped organ or gland that is located right here on your neck, okay? And its sole is to produce thyroid hormones, and most of it is which most people might know, but this is not the active form that your body uses, and produces a little bit of T3, which is what your body needs. And those two hormones work together to pretty much stimulate energy, right? It affects your heart, affects your gut, affects the whole system. So the thyroid gland is very, very important. A third hormone that a lot of people don't talk about is calcitonin. The thyroid glands also produce that. And what it does is to help regulate calcium level in your body. But for the purpose of what most people have issues with, we'll only be focusing on the thyroid hormones T3 and T4. Now, in a thyroid disease, your body does not work the way it's supposed to. So the thyroid gland might produce a lot of these hormones, and that's where the doctor will diagnose you as hyperthyroid, meaning you have a lot of thyroid hormones in your body. Then the hypothyroidism will be when your body does not produce enough. So it's too low, and there are other symptoms that the person will have that will point the doctor into thinking, okay, this might be what is going on, as well as other labs that they might run. So thyroid disease is pretty much when the thyroid gland doesn't work the way it's supposed to work.
Wow, amazing. So not only are you looking at, okay, it could be high, but you're also looking at, okay, people that don't even have enough. So that's a very diversified disease state, right? You
Yes,
have to
yes.
know
So
what you're looking at when you're looking at them.
yes, it has to be in equilibrium, in balance. So if it's out of balance, it's a problem. If it's too high, problem, too low, a problem. Yeah.
Now, if a person is like, okay, how do I know I have thyroid? What should I be looking for? How do I know I have a thyroid issue? What kind of signs and symptoms should they be watching out for?
Yeah. So for people that will have hyperthyroidism, that they have too much of the hormones in their bodies, some of them will have rapid weight loss, which is mostly what makes people like, okay, something is really wrong. They might just lose weight without even trying. They're not trying to lose weight. They're eating, they're doing all the things they're supposed to do, but they're just losing weight. They also have increased appetite because your body is like in hyperdrive. It needs all the energy it can. So they can have increased appetite. Some of them might have hair loss, although that can happen in both hyper and hypothyroidism. So whether high or low, they can have weight loss, hair loss. And another thing is they are easily hot. So they get hot quickly. They can also be shaky, nervous, and jittery, quickly startled. And another most common one too is heartbeats. So they might have irregular heartbeats. Some of them might even go to the doctor and they will diagnose them with arrhythmia, which is like irregular heartbeat, and give them medication for that, but not even looking at the thyroid or what it's doing. So sometimes that these hyperthyroidism can present in that form. Now for hypo, you would see the opposite of it. They have, they're, in terms of weight loss, they have weight gain. So these people are doing a lot. They're trying to lose weight. They're eating the right food. They're dieting, they're exercising, they're cutting their portions, but they just can't seem to get the weight off. That's because the thyroid that is supposed to also help with weight management is not working the way it's supposed to work. Another thing is that they get cold easily. Some of them might be depressed, and you can't believe how many times people go to their doctor with depression and they start them on depression medication without even checking the thyroid first. Because if we can balance that, that could help the depression symptoms. Another not so common side effects, acid reflux, not side effects. Symptom, acid reflux. Now, if a doctor, you're a pharmacist like me, if most likely people that have acid reflux, what did they go to the doctor? When they go to the doctor, what did they prescribe for them?
Sometimes it's Prilosec or omeprazole or Nexium, and they send
Yeah.
them home.
Yes. and that what those medications do is to block the acid. So the doctors are thinking it's going to block the acid, because obviously it's the acid going back to the esophagus that is causing the heartburn or the acid reflux. But in hypothyroidism, it's not actually overproduction of acid. It is actually underproduction. And the reason they have those similar side effects is because the food gets into the stomach and just sits there and ferments and pushes back up. And then they have that symptom, they go to the doctor and they give them acid reducer, but it's not going to do anything for them. So I have people saying, I've been taking this medication, it's not doing anything. Yes, it's not doing anything because that's not what the issue is. You actually need more acid production. So that's a less common symptom of the hypothyroidism.
And what you saying this, it just brings me to the whole point of like finding the root cause of what the problem is, because someone might go into the doctor, like you said, and they're complaining about acid, and it's like, oh, okay, well, let's put a band-aid on it, because they don't know what the root cause is, right? And so like that's what functional medicine is, right? You're trying to find the root of what's going on.
Absolutely.
Yeah. Amazing. So now I also hear a lot about people talking about thyroid being an autoimmune problem. So if you could just kind of describe like what is autoimmune disease, like what is autoimmune, and what does it mean for someone who doesn't even understand what that language is, and how does it relate to having thyroid issues?
Yeah. So for thyroid issues, there's a lot of things that can cause it. It could be deficiencies in iodine. It could be cancer. It could be that the person is taking a medication that actually attacks the thyroid gland, like chemo. Most of these chemotherapies actually attack the thyroid gland. Now, if the person does not have any of that, and the doctor has done all these risk factors, there's nothing really going on, the most likely cause would be autoimmune. And autoimmune, if we break the two words apart, auto and then immune. Immunity, so the cells in your body that protects you from infection. And auto means is like by itself, it's turned on by itself. So what happens in autoimmunity is that your body, which is supposed to protect you, your own cells, and attack the foreign bodies that are coming in like bacteria, virus, it sees the thyroid gland as a threat. And it will secrete antibodies, and these antibodies is what goes to the thyroid gland and attacks it. Sometimes if it's in Graves' disease, it attacks it and actually makes them produce more. It's almost like, okay, you need to make more hormones. And in Hashimoto's, which is hypothyroidism, it destroys the thyroid glands. So over time, the thyroid gland will start producing less and less hormones. Now, on that Hashimoto's, it can happen in 3 stages, right? The immune system turns on, starts destroying the thyroid gland. The first stage will be the thyroid glands are containing these thyroid hormones. As they're being destroyed, it releases the hormones into the system. And it's like the body is flooded. They're in a temporary state of hyperthyroidism. And with time, when those cells has died off, the thyroid hormones has been removed, the cells that are remaining start producing less. It's not enough. So they go through a phase of hypothyroidism. Now, if the attack is stopped, the autoimmunity is stopped, everything is balanced, the thyroid might actually have a chance of being regenerated back to how it was. So it can kind of balance everything out. So in autoimmunity, just to summarize, is your body attacking your cells.
Oh, that's crazy, because that's like you almost don't even have, you really can't control it, because you don't even know what,
Yeah.
it just turns on by itself. So that's more, I'll say maybe more dangerous, because
Yes.
now it's your body attacking itself pretty much, right?
Yes. And another thing with autoimmunity, most people that already have an autoimmune disease like multiple sclerosis
Mhm.
or type 1 diabetes, a lot of people don't think of type 1 diabetes as autoimmune, but it is autoimmune.
Yeah.
So those people, when they have those attack going on, if it's not controlled, it can actually go to the thyroid and cause issues. So these people can have
Wow.
like multiple diagnoses, not just, oh, I just have a thyroid issue. So that's
Mhm.
why inflammation is something that needs to be contained. It's something that needs to be stopped, because if you leave it uncontrolled, not only the thyroid is being affected, your whole body is being affected.
That's crazy. So now tell us, does functional medicine help with treating, thyroid issues, and how?
Yeah, great question. Yes, it does. And the reason why functional medicine is unique is that functional medicine will look at you as a whole body. Now, if you go to your primary physician, what they're going to be doing is just your basic labs. They're doing the general looking at you. And if you complain of any other additional issue, they refer you to a specialist. But in functional medicine, we're looking at everything. If you have something with your eye and something with your leg, it's most likely connected. So we're not going to tell you, hey, go to your eye doctor and then go to the podiatrist, because if we can fix what is going on, we can, both issues can be resolved. Now, functional medicine, we do take a in-depth look and we find the root cause. You mentioned that earlier. So the key thing is what caused it. Your body should function, properly the way it's supposed to, but when it's not, something caused it to be knocked out. Think of it like a train. A train will continue on the course, on the tracks, unless something comes and knocks the train off of the track, and the train would, derail. So we want to find out what caused it. And that's where functional medicine comes in. And functional medicine can totally help anyone with thyroid issue, especially if it's autoimmune.
So now that's very interesting, and a lot of people are still kind of like understanding functional medicine,
Mhm.
which people think it's something that just came on the scene. But if you
Yeah,
really think about it, it's really how medicine has been practiced for a long time, and it's just people going back to what
the
it's
roots.
originally supposed to be. So now the
Yes.
question is, can thyroid disease be treated in natural ways?
Yes, it can. Because
Okay.
once we find what the root cause is, we can remove it. And let's kind of talk about, you have a book that talks about detox. So if you can detox that the toxins or whatever that's causing it, and then prevent re-addition of that toxin, you can now allow your body to heal and also introduce any deficiencies, because it is a lot of components. It's not just one thing. No one comes and it's just one thing that is causing it. There's the root cause, which is what has set the body off. And then that will lead to a cascade of other things that will need to be fixed and put together. So that's where functional medicine comes in. We take an in-depth look. We run additional labs that your doctor will not be running. We're checking for any toxins like metals or BPA, which is found mostly in plastics. And we're looking for all those things. And once it's found, we can work on a plan together to remove it, and also to maintain your healthy body function.
Awesome. I love that. I love that. And a lot of people will really love this information because even just working in a pharmacy, I would see a lot of people come in and they cannot miss their medications. You know,
Mm-hmm.
it's like if I go off of it, my whole system is off, right?
Yeah.
So them knowing their natural solutions, you know, out there where they could, you know, either integrate it to what they're already using and essentially kind of, you know, titrate off of those medications that they already
Yeah.
take. Like they're just knowing that there are options out there. I think is really important for people to learn of those options, right? What do you think?
Absolutely, absolutely. You know, before I came across functional medicine, I had patients that would come into the pharmacy. There's this one lady, she had so many things, and this was all stemming from her multiple sclerosis. So she's initially diagnosed with that, and now she's having all these other things pop up. She was on like 4 different blood pressure medications because they just couldn't seem to control it. She was on gabapentin for her nerves. She was taking something for diabetes. It was just crazy. Can you imagine if I had this information, how I would have told her, look, these issues is one thing. Inflammation, autoimmunity, we need to get it in control. So it's really good for people to have an option, an alternative, to not just say, okay, I went to see my doctor, here's the medication they gave me, and I have to take it for the rest of my life. I don't think that's fair. You know, one should be able to make a decision on what they want to take for the rest of their life.
Do you think maybe maybe doctors would have a better chance of actually looking for the root cause? Do you think maybe insurance plays a part to kind of limiting what a doctor could do?
Yes, yes, absolutely. Because say the way the conventional way works is that the insurance pays for the doctor to talk to the patient for maybe 15 minutes at a time. And after 15 minutes, that's when you're dying. And most of these doctors, they're overwhelmed because a lot of people are coming in, they're seeing them, they have to see like 40 patients in a day. They don't have time to dive in. So that 15 minutes, all they want to know is, what do you have? I have a headache. Okay, here, take Tylenol. Or I have heartburn. Okay, here you go, take omeprazole. They don't have the time to dig in. And I'm very sure if they're given the time, and this is by insurance reimbursements also, and also if the patient is, you know, willing to pay cash to really set time apart and dive into it, then with the right education and knowledge, these doctors can actually be more helpful and not, you know, do more than they're able to do right now. So it's almost like the insurance company has their hands tied behind their back. So they have to kind of perform miracle. You can't do everything. And also the school system, you already divided from, you know, once you're coming up, oh, this is a cardiologist, this endocrine, this is pediatric, this is that. So you're already like divided and you're not even allowed to cross into the other person's area of expertise because, man, Lord, you're stepping on my toes.
Pretty much. And so, what would you say are ways a person could probably boost their thyroid if they're just trying to see how they could do it on their own?
Yeah. So the first things first is to get a control of the immune system, of the overactive immune system. Now, for us to talk about the immune system, I have to talk about your gut. Gut health is very, very important. There are 2 things that protect us from the outside world and protect your cells, your body, and everything. The first one is your skin. The skin is your first protection. The second one is your gut, because if it doesn't enter through your skin, then it's entering through your mouth. And the only way it gets into your body is if it goes through your intestines and enters into your bloodstream. 70% of our immune system is in our gut. So if we can take care of our gut, then you can almost turn on and off anything that you want to do. I mentioned gluten. I don't know if I did, but gluten is one of the big no-no for autoimmunity. Gluten destroys your gut lining. And when I say gut, I mean your small intestine mostly, and then some large intestine, but mostly your small intestine. It destroys that lining, and that barrier that's supposed to be a tight wall that doesn't let anything pass through. It destroys it, and things can pass through, including gluten. And when your body, your immune system sees it, like, hello, you're not supposed to be here, and then they launch an attack. But the thing is that it might not really get rid of the gluten, but your cells become collateral damage. So it's almost like they're looking for somebody, but you're in the wrong place at the wrong time, and then you are taken just because you are there. So that's kind of how your body will look at gluten. So taking care of your gut, some foods that you can avoid, like sugar. Sugar is a big no-no. It can cause, your body doesn't know what to do with sugar. Your body does not know what to do with sugar. And when I say sugar, refined sugar, white sugar, brown sugar, anything that has gone through the mill, your body does not know what to do with it. And it also destroys the gut lining. So getting control of your gut, clean diet, not just I eat fruits and vegetables, but where's the fruits and vegetables coming from? Is it pesticides free? Because those pesticides are also an issue. So having a clean diet, reducing inflammation by exercise. Exercise is a good way to reduce inflammation. And it doesn't have to be strenuous exercise, just a light work, 10 minutes, 15 minutes work every day, every other day is better than nothing. So your health, your exercise, gut, and clean diet, I think this is just like a base that one can start with, and removing things that cause more damage, like gluten and sugar. So
have you seen a lot of people that maybe would benefit from maybe supplementing their nutrition by taking maybe supplements, and what do you suggest in that arena?
yes, absolutely. So the most studies, when they looked at people that have autoimmune disease like Hashimoto's, which is like the most common autoimmune, they noticed that they don't have enough selenium. So most of them are deficient in the selenium, and they've seen that selenium helps to like kind of calm the immune system down and reduce the antibodies that are being formed. So if they're low on that, it's not really calming the body down. So they need the selenium to at least come into role to kind of modulate the immune system. Now, I wouldn't say just run out and don't take selenium, because some people might not be deficient in selenium. And if you go take too much of it, then it can actually cause problems. So that is one of them. Vitamin C is another one that not a lot of people look at, but it's very instrumental in your gut health, not only immune system, in your gut health, to help to heal the gut lining, as well as vitamin D. Vitamin D is a very good one too. Now, for vitamin D, most people are deficient in it because we don't spend a lot of time in the sun. And even if we do, like for us colored people, the melanin is blocking the sun rays. So most likely we are deficient in it, but most people are deficient in vitamin D, and they actually need more of it. And there's some speculation that the low levels of vitamin D is actually what is also helping the immune system not to act the way it's supposed to act. So vitamin D, vitamin C. Now for vitamin C, more is water soluble, which means it doesn't stay in your body too long. Your body will eventually get rid of it. So you need a daily intake of it. Now, if you're taking citrus or any strawberries, anything that has vitamin C in it, you might not need that additional supplementation. And that just might be enough, but you have to eat them every day. So that gives you your daily boost. So I would say those are the three basic ones that one can start with.
Yeah, definitely. If anyone out there is considering it, you want to make sure you talk to your doctor and make sure it's something that you can implement into your
Yes.
regimen. And so, because different people react different ways, so just check with your doctor before you start any new, regimen. So I'll definitely
Yeah.
want to add that as well.
And another thing I wanted to add, now, most people are looking for, oh, what will I take? What will I take? There's also, what should I avoid? What should I avoid? For people that have hypo or low thyroid function, I would say you need to avoid cinnamon, because in some studies, it showed that cinnamon reduces the amount of T3, which is your active T3. So it reduces the level. Now, if you're taking external hormone, maybe levothyroxine or Synthroid or any of those ones, the cinnamon might actually be working against you. So it's almost like you can never get to where you need to be. So if you need to take it, just make sure you're taking it on a consistent basis, so that if the doctor is adjusting your medication, it's not going to be an issue. The key thing is consistency. If you want to do it, just do it consistently. But if it's not, do it today, don't do it next week, or but just keep it consistent, so that you're not just running around and having side effects and having to run to the doctor back and forth for it.
Oh, that's a good point. I've never heard of that, cinnamon. So yeah, and so people, you might need to get in the habit of looking at the ingredients when you eat something. So you make sure, they're not, maybe those ingredients are not like sitting inside of the things you're trying to eat, especially in pastries. So some people don't think about it, right? When you're eating different things, like maybe it could be like a flavor in the ice cream or cake or bread, so definitely make sure you kind of get into a habit of understanding the ingredients that you're consuming. And if not, then get with Dr. Z and let her help you. So we're coming to the end of this episode, but I really want to make sure that people know how to get in touch with you. So could you just let us know how they could find you?
Yes, absolutely. You can find me on Instagram at Dr. Z, Dr. Ezinne Ozurumba, or on Facebook at Dr. Ezinne Ozurumba. Or if you're on LinkedIn, you can find me too at the same name. And if you need any additional resources, I have a free cookbook that I'm giving away. So you can click on the link on my bio and put in your email information, and the cookbook will be on its way. So if there's any other way I can help, I also have a free complimentary discovery call where we can talk about your goals and what you want to achieve. And that is available to you free of charge for 15 minutes. And we can kind of see how we can work together.
Awesome. And could you just spell out your name so they know how to search for you on Instagram or Facebook?
Sure. It's Dr. Dr. Ezinne Ezinne Ozurumba Ozurumba.
All right, perfect. I really appreciate this. This was very enlightening. I learned a lot about thyroid disease, especially since I work with women who suffer from PCOS, and I see a lot of them also have the issue of thyroid. It's all connected. It's the pituitary gland going into thyroid and all those other crazy things. So I enjoyed this episode. I know my listeners really benefited from it, and y'all make sure you follow her and stay tuned. If you also listen to this show, I want to make sure that I get in touch with you. Text me wellness to 832-400-6829. Thank you so much for your time, Dr. Ezinne. Thank you so much for being here with us and educating us. I really appreciate it, and we'll talk to you another time. Take care.
Thank you so much for having me.
All right, you're welcome. Bye-bye.
Thank you. Bye.